Hey everybody, this is Jasmine Banks, and we're going to talk about getting braces and how having a medical condition or a disability could affect which kind of braces you should or shouldn't get. Old-fashioned metal mouth or Invisalign braces. So, I myself got braces when I was 13, 14 years old, the old-fashioned metal mouth kind, and they had a great outcome. I had a confident smile after that, but when my wisdom teeth came in, my retainer no longer fit, and because we were just in crisis medically where I was concerned, because I had a disease called juvenile rheumatoid arthritis, which put me in a wheelchair and was causing all sorts of crazy chaos with me, the retainer issue just seemed to not be the most important thing. Speeding forward, my teeth moved out of place again. I returned to what was an open bite, and also they're getting crooked now, which I am so thrilled about. So I decided I better do something about this. I'm not getting any younger. They're not getting any straighter. And when you have a disability and you have a disease that's causing a lot of issues in your body, everybody wants something about themselves physically that they feel confident about. And since my smile is something I can do something about, I'm doing something about it. So, because I have 5 major joint replacements, I had to go with Invisalign braces. Why, you ask? Well, when you have a joint replacement or a breast implant or body art or a pacemaker or anything that did not grow naturally in your body, you need to be very careful of a secondary infection. For example, if I was to go to the dentist for a cleaning, I have to go on antibiotics to go there, because while they're digging up under your gums and cleaning, they're letting bacteria in there. That bacteria will get into your bloodstream and can cause a secondary infection, which can settle in one of the joints. If you got a paper cut, a splinter, an ingrown toenail, and it becomes infected, it can put a secondary infection in one of the joints, the breast implant, the body art, yada, yada, yada. Now, what can happen with a secondary infection? Well, they will try to treat it with antibiotics. Often this doesn't work. You have to go into the hospital, and most probably they have to remove whatever it is, whether it's a knee, a breast implant, whatever. They have to remove it. They have to try and clean out that infection. They have to wait 6 weeks, and then they have to attempt to put it back. If they can't, there could be an amputation, let's say if it was a leg, or it could be with a breast implant that you just can't, put the breast implant back, and it can even have fatal consequences. So it's a very serious issue. Now, how do braces affect this? Well, if you're going to put metal braces in your mouth, they are going to constantly rub on the side of your mouth, causing abrasions, and that is putting you at risk for bacteria getting into your system and causing a secondary infection. So metal braces would have been a great choice for me because they treat open bite much better than Invisalign would. Why? Because the engineering of braces is very interesting and complex. When they can put the metal bands around your teeth and the hooks, they can put rubber bands on and they can pull your mouth closed. With Invisalign, they can't do that. They can pull things back, they can pull crooked teeth into place, but when it comes to pulling down, it has some difficulties there. That's the simplified answer. But I had to choose my health over how much of a goal there was going to be with my smile. I will still be able to achieve something. The teeth are going to get straightened. The open bite can be dealt with a certain amount, and that's fine. So, as you can see right now, well, you can't really see, I have the braces on as we speak. They are on my bottom teeth. See? You can't even tell. And that's the great thing about them, especially if I was a teenager, and especially nowadays, it's kind of the in thing to be a teenager with braces, and they put the colored rubber bands on them, and all the kids love them. My son was thrilled to find out that he was having braces, because that's what everybody's doing. In my day, this was not the case. But I'm 45. I really don't want metal mouth at this age. If I had to go that route, I would deal with it. I'd have fun with it, whatever. But it is kind of cool to be able to put this plastic tray in, and nobody knows. Now, how do they make Invisalign braces? They take a mold of your mouth, they put that information into the computer, they move the teeth around into the goal that they want for your mouth, where the teeth are all aligned, and then they make incremental steps, and they make these plastic trays so that every 2 weeks you put a new tray in, it moves your teeth just a little bit until you reach your goal. Now, is it painful? Yes, of course it's painful. It's moving your teeth around, but it's not the worst pain in the world. Now, things that you have to be concerned about with Invisalign braces. When they're going to put them in, they do have to rough up the side of some of your teeth, because they have to put these little knobs on so that they can grip. There's little grips that are on the braces, so that when they're pulling, they can pull the whole thing back. You know, I'm not in love with that part of it, because that is taking a little bit of the enamel away. If you believe in homeopathic medicine, they have a remedy called calcium fluoride that has been proven to grow the enamel back onto your teeth. So I would consult a homeopath if you wanted to go that route before you begin with the braces, and ask them, well, how should we proceed with this? Is this something that you would treat before or after? How do you do this? I wouldn't try it on your own, because homeopathy is a complicated science, and you want to do it right if you're going to do it. Now, beyond that, there are some other issues that you want to be a little bit concerned about when it comes to the braces. Like all braces, you have to be careful about oral hygiene, because you are more susceptible to cavities, because food can get caught in the braces, especially the metal ones. But with the Invisalign braces, the advantage is you get to pop the braces out when you eat. Now, this is great because it means you're not limited, like the metal braces, to certain foods. Like, if you have metal braces, you can't eat nuts, you can't eat taffy. There's a whole host of foods that could break them off. I know this because we were constantly bringing my son to the dentist because there were things he would eat, pretzels, and it would just break the braces off. So with Invisalign, you do avoid that. Now, you do need to be very careful about your oral hygiene with the Invisalign braces, because you have a tray that's completely encasing your teeth for 22 hours a day, and you know, that's a great way to grow bacteria in your mouth. So when you eat, you've got to brush your teeth afterwards, you've got to floss them afterwards. That still isn't going to completely prevent the problem. You can get gum infections, gingivitis. There is a link between gingivitis and heart issues. So especially if you have any kind of an illness, you're more prone to complications. So you want to be careful about this. If your immune system is compromised, again, you want to be careful. It's very important to take an oral probiotic. The one I use is called Evora Plus, EVORA Plus, and it's just a little pill that dissolves in your mouth. It's just like eating yogurt, but it's specifically for the mouth, and it helps balance out the overgrowth of bad bacteria. The other thing that you may need to do periodically is get an oral rinse for gingivitis. Your dentist would provide you with the one that's suitable to your situation. And every once in a while, if you find that your gums are hurting, you may need to use this. Even rinsing with peroxide first and then using the oral rinse is a good thing to do. I notice that is a good preventive maintenance for me. You also want to clean these trays. What I do is I take a bowl and I put either peroxide or baking soda. I tend to alternate it, and I just soak the braces in there when they're not in my mouth. You do not ever want to use hot water, because remember, it's plastic. It's going to melt it just enough that you're misshaping it, and it may, not prepare your teeth for the next step. So you could actually fall behind because you've weakened them. If you drink a hot beverage, again, it could suddenly make it mold to your teeth as opposed to it's pulling your teeth to what it is. So you have to be really careful with them. You don't want to use anything else like mouthwash or whatever to clean them or soak them in, because you want to be careful again not to affect the shape of the braces. So baking soda, peroxide, diluted in water. It's perfect. I even take baking soda and I use a toothbrush and I scrub them. Again, really important because otherwise they can get kind of funny. So those are some of the things you want to be very aware of. Now, the other issue with Invisalign braces is how the heck are you getting them out? Especially if you have, let's say, arthritis or any kind of a hand issue, that only complicates it. If you have normal hands, it's difficult enough. So when you get the braces, they give you this little tool to take them out, and it doesn't work. So it's a waste of time. Now you could stick your fingers in the back of your mouth and try and pull, and it's really, really difficult. Now I went online, and I found this tool. Wasn't very much money. They send you like 7 of them. It was like, I think, $20. And it's got a hook over here, and it's got this other little pointer there. And in 2 seconds, I've got the braces out of my mouth. Very handy to have since they send you so many. You can put one in your toothbrush holder, you can carry one in your purse or your pocket, and it makes life much easier, because the last thing you want to be doing is fiddling around getting these things in and out. And if you've got hand issues, you really don't want to hurt your hands. And that was my huge concern, because I have arthritic hands. I have to not only be careful about the joints, I can rupture tendons. There's a whole bunch of issues where I have to treat my hands more delicately than a hand model treats hers. So if you're on the road to finding a new smile, make sure that you ask your dentist lots of questions. There can never be too many when it comes to the safety of your health. Also, make sure you give him your medical history, your full medical history, because that could affect what decision is best for your health and also still achieves the smile that you want. So if you have any questions or comments, I'd love to hear them, and best of luck on the journey to find your confident smile.